Hi, I'm Mara Antonoff, and I'm here at AATS 2024, here with Dr. Marc Perrot, and I'm really excited for him to tell us all a little bit about his presentation that's going to take place tomorrow. Can you tell us a little bit about the study that you're going to be presenting?
Yes, certainly. Thank you. The study is on in mesothelioma. It's the SMART-R trial. It is to look at the role of radiation prior to surgery and define the ability to radiate the lung before a lung-sparing surgery, particularly. The second component of the trial was to define the mechanistic response to the radiation from the immune system.
Terrific. And so, can you tell us a little bit about what the study design was?
So the study design was a phase 1 trial to look at incremental dose of radiation to the whole hemithorax with a higher dose, an ablative dose to the tumor itself. That was done 1 to 2 weeks before the surgery. The surgery was done at the time of the or 1 or 2 weeks after the radiation in order to ensure that the immune response will have time to take place. And the dose of radiation was progressively increased to ensure that there was no side effects from the radiation on the lung.
And how many patients were involved?
There were 12 patients on study, and we've done 12 patients out of study with a similar protocol.
Terrific. And can you give us a little preview of what you found?
Yeah, so we found that you can give a 12 gray of radiation in 3 fractions before the surgery, before lung-sparing surgery safely. In patients who had no prior treatment for mesothelioma. We found that the radiation was activating the immune system quite strongly, actually. And that was particularly seen in a subgroup of patients who have mutation or an absence of mutation in the CDKN2A, so the absence of P16 homozygous deletion, were the group of patients who had the most immunogenic response. So that gives us potentially a biomarker to move forward on select our patients who may respond to the radiation more specifically.
That's terrific. This may be a little bit of a controversial question, but certainly we've seen since Dr. Lim's presentation of the MARS-2 trial that there are some questions about the time and the place and the right patient for when we should be performing surgery at all for patients with mesothelioma. Can you put the context of your current trial, frame it for us with what we know about what we've learned in the last couple of years?
Yeah, certainly. So, the trial, the MARS-2 trial, was certainly a very important trial. A lot of patients, a well-run trial, and it is certainly showing that we can do the RODOMAS trial with surgery in mesothelioma. Now, increasingly we see that the histology plays a role on the subtype of mesothelioma, the macroenvironment plays a role. And interestingly, the P16 homozygous deletion positive seems to be more inflamed and potentially responding better to immunotherapy. So the limitation of the MARS-2 trial was the use of chemotherapy rather than immunotherapy, which has been a dramatic change over the past 2 or 3 years. So it still raises the question, what is the role of surgery in the context of immunotherapy? And we do see that epithelioid disease do not respond well to immunotherapy. So possibly radiation, surgery, and immunotherapy may be a better treatment than just immunotherapy alone. And that's what we are looking now in our current trial.
So just like everything else that we're seeing in thoracic oncology, it's more and more utilization of multimodality care, more multidisciplinary collaboration, and figuring out how we can use all of our tools together for the right patient.
Yeah, that's exactly right. And increasingly use the biomarkers to really lead to more personalized therapy to determine who is going to be the responder to the treatment and avoid the side effects as much as possible.
So would you recommend that folks who hear the results of your study start implementing radiation preoperatively at their institutions, or is it not ready for prime time yet?
Not ready for prime time, I would say. I think we still have to learn, have to reproduce the data, and we have to integrate that with immunotherapy or some form of immunotherapy. It may not be the ipilimumab, nivolumab, which is currently the standard of care. Other form of immunotherapy may actually be better for epithelioid disease, and that's part of what we are looking at in our sample right now to characterize the potential immune target.
Well, it's been so wonderful to learn about your study. Do you have any take-home points or closing remarks you'd like to share with people about this?
Yeah, so I think mesothelioma has been a disease with a dismal prognosis for a very long time, but I think we're starting to see more and more exciting results. We need more clinical trials.
Sure.
But I think we are entering a new era in mesothelioma with immunotherapy and more personalized care.
Yeah, terrific. Well, thank you so much. We really appreciate your time.
Thank you very much.